Hello everybody, welcome to another medication management lesson. 大家好，欢迎回到多一个药物管理课。This will be lesson 5. 今天是课程5。So today we're gonna be moving on from the major mental illness topic, and now we're gonna talk about medication, their uses and side effects. 虽然我们上次是那几堂课，我们都在讲的是那些最主要的那些精神病。现在我们要讲的是药物的用途和副作用。So, before I begin, I just want you to know that if you see any words in there that you cannot understand or anything, I just putting in Chinese 汉语拼音 so I can better pronounce it. Okay, so if you see something weird, just ignore it. Okay, so the objective for this lesson is to understand the basic categories, effects, and side effects of the medications for 3 severe mental disorders. So I'm gonna be separating these into 2 lessons. So if you don't see all types of medication, maybe you'll see it next week. 所以我们今天的主要目的是要了解3种严重精神障碍的药物的基本类别、影响和副作用。如果你们看好像因为我们把它们这堂课分成两个课，所以如果今天你看到有些药物没有出现的话，或者那个精神病的那种药物没有出来的话，是因为我们会下个礼拜才讲解。So first of all, let's begin with asking how do medication works. So 所以现在我们先讲的是药物如何运作。Okay, so many drugs do their work by altering the transmission system by which messages are sent from one part of the body to another. So transmission system would be actually neurotransmitters. Neurotransmitters are kind of like tiny messages. They are the messengers of your body. So they carry information from one part of your body to another. So the function is to correct or modify the communication of the signals that traverse the nervous system. Okay, so they modify the communication. So by doing so, it actually relieves symptoms or restore normal functioning and behavior. 所以呢，许多药物是如何运作的呢？许多药物通过改变传输系统，传输系统是这个系统是将消息从身体的一个部分发送到另一个部分的，来完成他们的工作。他们的功能是拯救或修改穿过神经系统的信号的通信。这样一来，他们可以缓解症状或修复正常功能和行为。Okay, so generally there's a trade-off between the benefits and side effects of drugs. So usually, if the drug is more powerful, the greater the side effect. This is very important for you to know, okay? So if the drug is more powerful, their side effects usually is also greater, which is not a good thing. Side effects are not good. 所以一般来说，药物的益处和副作用之间存在一个权衡。所以药物越强大的话，副作用也越大。副作用越大的话，也是一个不好的事情所以你们要记得这一点 ，OK？ So now let's talk about drugs. 我们现在来讲药物。Okay, so drugs are substances that cure and contain diseases. It also ease pain. It provides other benefits and include essential vitamins, supplements to correct deficiency diseases. I think you guys know, right? All this medication. 所以药物可以治愈和遏制疾病的物质，会缓解疼痛，还有提供其他的好处。它还有含有人体必要的维生素、补充剂以拯救缺乏症。Okay, so where do drugs even come from in the first place? 所以药物是来自哪里的呢？ Okay, so drugs are synthesized forms of natural products. So it's like they will go through some process, but they actually came from natural products. What are natural products? Things like plants. Plants are turned into chemicals. Example, morphine. This is a painkiller. And morphine comes from poppy, a type of plant. And animal parts are also used to make drugs. For example, insulin. Insulin we usually use for diabetes, right? Insulin jabs. So it's actually from pig and cow pancreas. Pancreas is the part near our stomach, okay? 所以药物是来自哪里的呢？药物是用天然产物合成的。那天然产物是什么呢？天然产物可以比如是植物，植物会转化为化学物质，例如 因素中的吗啡，吗啡是那个painkiller 来的，是那种止痛药来的，算是还有除了植物，动物也可以拿来当药物例如来自猪和牛的胰腺胰岛素，牛胰腺的胰岛素，胰岛素是我们用来治糖尿病的，OK。So now we're gonna talk about common medication used in mental illness. Maybe if you have like some of these, if you have this mental illness, you'll probably see the medication you use over here. Okay. So 我们现在要讲的是精神疾病的常用药物。如果你看到像你的病情在屏幕上，有可能你会发现你的药也有放在那边。Okay, so this one is for anti-anxiety. Okay, so anti-anxiety agents are actually called benzodiazepines. And these are like some of the main few medication that are used in to stop and to relieve anxiety symptoms. Okay, 所以这些是抗焦虑的药，它们是最通常的啦，最大家每次都用的这种。So if you have anxiety, these are some of the things you might take, like alprazolam, diazepam, lorazepam, buspirone, and hydroxyne. Okay, so generic name is basically how it's actually supposed to be called. That's the basic name. Brand name is basically just like, for example, we know Panadol, right? But that's not the generic name. Brand name is just what they call it, like what the brands or companies sell it as. 所以通用名就是好像他们真正的名字，就是 alprazolam 第一行的那个第一个 column 的 alprazolam, diazepam 这些是通用名。品牌就像好像我们用 Panadol 对不对？我们会叫它 Panadol， 可是它的真正名字不是 Panadol， 那个只是它的品牌。So 这些就是他们的通用名，还有他们的品牌，还有他们的平均剂量。Okay, so the reason why average dosage is very important is because you need to know what is the acceptable amount of dosage to take. Because if you take over the acceptable amount, you might actually overdose. And if you take too little, it might not have any help. So the thing about doctors, the reason why we go see our psychiatrists, the reason why we go and see our doctors, and how they help us modify how much dosage you should take, is because they go by your symptoms, and they have to follow a very strict rule to not go over the dosage and need to know exactly how much they think it will help you best. Okay, so they will follow what's the minimum to maximum they can give you. Okay, so maybe if they find that your symptoms are getting worse, they may increase it. So for example, if you are taking diazepam, you started with 5 mg, then they decided, okay, I'm going to raise it to 10 mg, but they cannot raise too much, okay? 所以为什么我们要知道平均剂量呢？因为你医生好像，比如我们不是你去看医生，你们看医生的时候，你跟他们讲你的情况的时候，有可能那个医生会帮你调整你们的剂量，对不对？因为原因是他们需要知道这个范围之中，好像比如 alprazolam 那个第一个是 0.5 到4的平均剂量。如果它给太少，就可能不会有效果。可是如果它给太多，就对你身体不好，因为是过度了，那个剂量过度了，可以导致好像身体不舒服，甚至死亡。所以医生每次要帮你们调药的时候，他们要看好像如果你症状你的症状更严重了，他们就有可能会调高你的剂量，可是他们不可能会调高太高啦，不可能alprazolam不可能给你10 mg 那种啦，因为他们也是要看那个范围，好像可以给你们多少的那种范围这种 ，OK？ So this is just the list. If you recognize any, then you can go see what's the dosage actually. 所以我放这边 mg 算是毫克，所以你们可以明白 ，OK？ So anti-anxiety agents, benzodiazepines, what do they do? Benzodiazepines affect the brain by enhancing responses to neurotransmitters, which is Gaba in the brain. So Gaba is actually a neurotransmitter that actually regulates anxiety. So just now, as you said before, neurotransmitters are basically tiny messengers in your body that sense information. Okay? Then for Gaba is a type of these neurotransmitters that regulates anxiety. So basically transmitters are like chemicals. They are molecules that like transmit signals. For example, I send signal to you, right? Then you send signal to another person, right? So this is kind of like a neurotransmitter. They send signal to each other, like they communicate. So for Gaba, it regulates anxiety. Then when efficiency enhanced, when benzodiazepines, which is the anti-anxiety agents, when they enhance the efficiency, then Gaba cause a calming effect to the brain, thus making the person less anxious. So that's how, in the end, like you feel less anxious because of benzodiazepines. Okay? 所以抗焦虑药是因为它是通过增强对大脑中神经递质的反应来影响大脑。那这个叫做 Gaba 的神经递质是调节焦虑的神经递质，所以它的功能就是好像帮你好像送简讯这样，跟另外一个神经递质讲，所以他们就传播那些信息，然后如果它有更强的效率的时候 ，Gaba 就会对大脑产生镇静作用，从而使人不会那么焦虑。OK， 所以这个就是抗焦虑药的它是怎么用的，是怎么让人家感到比较舒服平静的。Okay, as such, benzodiazepines are commonly used to treat alcohol withdrawal, anxiety, insomnia, panic attacks, and seizures. Because all of these things you need to calm down, right? Anxiety, seizures, all these. They are also used as sedatives and muscle relaxant, which you can understand why, because they cause you to feel relaxed. 所以因此呢，抗焦虑类药物通常用于治疗酒精戒断、焦虑、失眠、惊恐障碍和癫痫发作。他们还用作镇静剂和肌肉松弛剂。你应该了解为什么，对不对？因为他们可以让你感觉比较舒服、比较平静，所以这些比较好像感到压力啊、焦虑、失眠，不能好像好好的放轻松的时候，你就吃这种药的时候会对你比较有帮助。Okay, now we're gonna talk about antidepressants. So we've already talked about anti-anxiety pills, now medication. Now we're going to talk about antidepressants, and specifically tricyclic and tetracyclic. So 我们现在要讲的是抑郁药 ，OK？ 抑郁是忧郁症啊，是另外一个名字 ，OK？ So as usual, this is how you read the table, okay? So the first one is the generic name, is what they are actually called. And then the second column would be brand name, which is like Panadol, remember? And then the last one will be average dosage. So like what's the acceptable amount to be used? Okay? 所以你们怎样看是你第一个 column 从上读到下哦，第一个它是它的通用名，第二是品牌，就是我们刚才讲的 Panadol， 对不对？然后最后是平均剂量，就是大概大多数的人是从多少到多少，是好像最少的分量到最高的分量，就不可以好像太多也不可以太少 ，okay? So this one is for you to just look through it, and if you can identify any of your medication, you can go and see like, oh, what's my dosage, okay? 所以这个是给你们参考的，你们看好像那个如果你认识那个通用名的话，你就可以看你的平均剂量你是用了多少，对不对？Okay, so some antidepressants affect brain chemicals to ease depression symptoms. So they block the absorption of two types of neurotransmitters in the brain, thus causing an increased level in the brain. So these two types of neurotransmitters, when they stop your body from absorbing these two of neurotransmitters, so you still have more in your brain. So that's why you feel better. However, it also affects other chemical messengers, which can lead to a number of side effects. 所以压抑郁药可影响大脑化学物质，缓解抑郁症状。它们阻断大脑中两种神经递质的吸收。这个两种神经递质大概是让心情比较好的，从而导致大脑中的神经递质水平升高。然而，它们会影响其他化学信号，导致许多副作用。So some of these common side effects that from taking antidepressants for tricyclic and tetracyclic kind may include to prevent reuptake of tricyclic and tetracyclic kind may include blurred vision, constipation, dry mouth, drowsiness, urine retention, increased appetite, weight loss, excessive sweating, tremors, sexual problems, and a drop in blood pressure when moving from sitting to standing position. So I don't know if you know this, but like a lot of medication, especially for mental health, to like aid in like relieving mental illness symptoms, right? Is that a lot of these medication, right, actually brings about a lot of side effects. So sometimes you need to actually tell your doctor, like if you're feeling like you're experiencing any of side effects, like after you eat this medicine you feel very like increased appetite, or you have a lot of like you keep feeling like dry mouth, you need to let your doctor know, because it's affecting your body not in a good way as well. Okay, so they can help you like make some changes there. 所以一些常见的副作用可能包括视力模糊、便秘、口干、嗜睡、尿潴留、食欲增加、体重减轻、出汗过多、震颤、性问题，以及从坐立到站立姿势时血压下降。所以我不知道你们知不知道这个，可是精神疾病的药物通常会有很多副作用，所以这些副作用也是很不舒服的，就是好像比如嗜睡，一直很想睡，或者一直口干，所以你们要让你们的医生知道，比如好像他给你新的药后，你就感觉不舒服，有很多好像别的症状的话，你就要跟你的医生讲，所以他可以帮你好好调理 ，OK？ So antidepressants, there's two kind. Just now was the one to block the reuptake of tricyclic and tetracyclic, which are neurotransmitters. But there's also selective serotonin reuptake inhibitors. Okay, so we'll get into that later. Okay, like for now it's a very big word. You just remember it as SSRIs. Okay. 所以抗抑郁药有两种，第一种是这个你看到上面那边写 tricyclic 和 tetracyclic 的那种神经递质，是他们阻断那两种神经递质被身体吸收。可是现在我们要讲的是抗抑郁症选择性强摄按在摄取抑制剂。OK， 所以现在我知道很那个字很长，很多字，可是我们等下会讲解。OK。So as usual for antidepressants, I think this will be more common. Maybe you notice like you have taken this before, like fluoxetine, sertraline, paroxetine, fluvoxamine. Okay, so as usual, this is just for a reference and to know like how much and how little you are allowed to eat and not to go over or under. Okay. 所以跟刚才一样，这是给你们参考的，你们可以看那个通用名，如果你们看到你们自己有吃的药，你们可以看它的平均剂量，知道自己不可以吃太多，也不可以吃太少，对不对 ？OK， 可是当然要按照你医生说的啊，你不要看这个你就乱吃啊。But just because I say this the average dosage doesn't mean you can choose whatever you want. Okay, you must follow the one that your doctor prescribed. Okay, so just now we were talking about SSRIs, selective serotonin reuptake inhibitors. It's very confusing, but it's okay. We just remember it as SSRIs. So how do these type of medication work? They work by increasing the levels of serotonin in the brain. Serotonin is also serotonin. Give me a second. Okay, serotonin is also a type of neurotransmitter. So as usual, we said the chemical messengers in your body, right? They are also a type of chemical messenger. And the thing is, serotonin is sometimes called the happy chemical because it contributes to well-being and happiness. So in order to like keep more levels of serotonin in your brain, the SSRIs, they work by making sure to like not to take in too much serotonin, so they leave more in the brain. So if your brain have more of it, then it can help you treat like anxiety disorders as well, and it can help you like feel happier because serotonin is supposed to be a happy pill, right? Happy neurotransmitter, right? Because it makes your mood feel better. 所以 SSRIs 刚才我们讲很乱哦，选择性 羟色胺在摄取抑制剂，它们是通过增加大脑中血清素的水平起作用，它们也可以用于治疗焦虑症。所以血清素是一种好像也是一个神经也是一种神经递质，可是它是让人家感到比较开心的，所以他们如果阻挡不让你的身体拿太多的话，那你的头脑里面还会有更多，对不对？所以因为它的水平更高的话，我们的身体我们自己就会感到比较开心。Okay, as usual, as with any medication, SSRIs have their side effects, which may include drowsiness, nausea, dry mouth, insomnia, diarrhea, nervousness, agitation, restlessness, dizziness, sexual problems, headache, and blurred vision. So as usual, if you have any of these symptoms from like the medication you're eating, you need to let your doctor know, okay? 所以与任何药物一样 ，SSRIs 也有副作用的，包括嗜睡、感觉恶心、口干、失眠、腹泻、紧张、躁动、烦躁、头晕、有性问题、头痛和视力模糊。所以如果你们吃了药，然后感到这种好像副作用的话，一定要让你们的医生知道。Okay, so for today we're gonna stop here. We're gonna still be talking about medication next week, like what kind of medication. So if you want to if you want to know more, you can go online to search for now. But now we're gonna go through a worksheet, okay? 所以现在我们要做我们的文件，我们的功课表。所以如果有什么问题的话，跟我讲。If you have any questions, let me know, okay? So okay, bye bye，拜拜大家。